Now today we shall discuss about the lymphatic drainage of the tongue. You know the lung cancer primarily spreads through lymphatics, and lung cancer is a very common disease, so you must have some knowledge about the lymphatic system of the tongue, right? Now here you see This is called jugulo-digastric group of lymph nodes. This is submandibular group of lymph nodes. This is jugulo-omohyoid, and this is the submental. So these are the lymph nodes into which the lymphatics of the tongue will drain. Right? Now, you know lung is divided into two parts, posterior third and anterior two-third. Anterior two-third again divided into deep, central part and peripheral part. Deep, central part and peripheral part. Now, from the tip of the tongue is richly supplied by the lymphatics. Its supply is bilateral. Bilateral means from here lymph will go on both sides. Bilateral supply means from here lymph vessels will go on both sides. And from the tip, the lymph vessels will go all the lymph nodes. Suppose from here, it will come like this. Again, it will come here also. From here, it will go here and here like this. So it is bilaterally supplied. It drains bilaterally. Now, from here also lymph will go to the submandibular. From here will go also to the jugulo-digastric, and from here it will also come to the jugulo-omohyoid. So from the tip of the tongue, it drains to all of the lymph nodes. So tip of the tongue is richly supplied by the lymph nodes. So if there is any cancer at the tip, the prognosis is very bad because it will involve all the lymph nodes. Now from the central part, from the anterior two-third, now from the marginal part generally it is unilateral. From the marginal part, lymph node will go unilaterally, not bilaterally. From here, lymph vessels will go to the submandibular. From here, it will go to the jugulo-digastric, and from here, it will go to the jugulo-omohyoid. It is unilateral, not bilateral. Right? Now come to the central part. Central part again, it is bilaterally, it drains bilaterally. So from central part, some will go like this, here, from here to jugulo-digastric, and from here to jugulo-omohyoid. Similarly, on that side also, it will go to the jugulo-digastric, submandibular, and jugulo-omohyoid, not in the submental. So it is also bilaterally drained. But marginal zone is unilaterally drained. Marginal zone unilaterally, but central zone bilaterally. Clear? And from the posterior third also, it will bilaterally, it will drain bilaterally. From here, it will go to the jugulo-digastric, and from here, it will go to the jugulo-digastric. Right? Lymphatic drainage of the tongue. The tongue, for lymphatic drainage, it has been divided into tip. Anterior two-third, it is divided into tip, marginal zone and central zone. Anterior two-third. From the tip, lymph vessels will go to all the lymph nodes, and it will go bilaterally, both sides, from the tip. That's why tip is called richly supplied by the lymphatics. Now come to the marginal zone of the anterior two-third. Here, lymph node will go unilaterally, not bilaterally. Unilaterally, no, that side only. Or from the left side, it will go to the left side only, right? But from the central zone of the anterior third, the lymph vessels will go bilaterally on both sides. It will go to the left, it will go to the right. Now come to the posterior third. Posterior third again, it will go bilaterally. From here, it will go to the left side, and from here, it will go to the right side. Right? So, this is the lymphatic drainage of the tongue. What is the characteristic of lymphatic drainage? You see from here that it cross-communicate through the median septum. Bilaterally, and by bilaterally means they have to cross-communicate. So, the lymphatics cross-communicate through the median septum. You know the tongue, actually it is divided by fibrous septum into two halves. So lymphatics will cross-communicate. When it will bilaterally go, it has to cross-communicate. So it is one of the characteristics of the lymphatics. That's why if one part of the tongue is involved, it will not only involve the lymph node of the same side, but it will also involve on the other side also. Now, generally lymphatics of the tongue do not accompany the artery. It generally do not accompany the artery. Now, so this is about the lymphatics, right? So from here you will be able to know which part of the tongue, so far as spread of cancer is concerned, which part of the tongue is more dangerous. First one, tip, second is the central zone, and third one is the posterior third. Only lateral third of the anterior two third, marginal zone, is unilaterally drained. So it is less dangerous as compared to other zones. So this is about the lymphatic drainage of the tongue. Right? Clear? Now come to the nerve supply. Nerve supply should always be discussed along with the development because it is connected with the development. This is the lingual swelling. This is the tuberculum impar, the lingual swelling. This is tuberculum impar. This is foramen cecum. Here lies hypobranchial eminence. Hypobranchial eminence. It is divided into cranial and caudal part. It is cranial part, the caudal part. This lingual swelling developed from the ventral end of the first branchial arch, that is mandibular arch, and this hypobranchial eminence involves second, third, and fourth branchial arch. It is again divided into cranial part and caudal part. Cranial part, actually it is mainly coming from the third branchial arch, and this one is fourth branchial arch. Now, where is second branchial arch? Actually, the third branchial arch, the second branchial arch is actually buried, and over it develops the third branchial arch and meets the lingual swelling. So it is not coming in this picture. Now, as it is from the lingual swelling coming from the first branchial arch, and from here the lingual swelling and tubercular impart, from here anterior two-third tongue will develop. So naturally you will be able to say the nerve supply of the anterior two-third. And you know the first branchial arch has got two nerves. First branchial arch has got two nerves. One is lingual nerve and one is chorda tympani nerve. Lingual nerve, post-traumatic nerve, and chorda tympani nerve, pre-traumatic nerve of the first branchial arch. So this part will develop the anterior two-third, and naturally it will be supplied by these two nerves, lingual and chorda tympani, right? Now from the posterior third will develop from the cranial part of the hypobranchial eminence, and this actually developing from the third branchial arch, and you know the nerve of the third branchial arch is glossopharyngeal. That's why posterior third of the tongue will be supplied by third nerve or glossopharyngeal nerve. And posterior most part of the tongue, that is etc., it will develop from the caudal part of this hypobranchial eminence, and this caudal part is developing from the fourth branchial arch. So that part of the tongue will be supplied by the nerve of the fourth branchial arch, and its nerve is fourth branchial arch nerve key. It is the nerve of the superior laryngeal. Superior laryngeal again divided into internal laryngeal and external laryngeal. So ultimately fourth branchial arch, which is responsible for the development of the posterior most part of the tongue, so it will be supplied by the internal laryngeal nerve. Clear? I am again repeating. First branchial arch, these two things, lingual swelling and tubercular impart, they are developing from the first branchial arch. And first branchial arch has got two nerves. One is lingual nerve and one is chorda tympani nerve. Lingual nerve is post-traumatic or chorda tympani is a pre-traumatic. So from this structure, you know anterior two-third will develop. So anterior two-third of the tongue will be supplied by the branches of the mandibular nerve, that is lingual nerve, and from the chorda tympani nerve. Now come to the posterior third. Posterior third develops from cranial part of the hypobranchial eminence. Hypobranchial eminence develops from second, third and fourth arch. Out of these, second arch actually gets buried. So actually here comes third and fourth branchial arch. From the cranial part develops the posterior third, and from the cranial part of this hypobranchial eminence, nerve is glossopharyngeal. So posterior third will be supplied by the glossopharyngeal, and posterior most part, its nerve is superior laryngeal. Superior laryngeal means internal laryngeal. Internal laryngeal is the part of the superior laryngeal. So posterior most part, that means the vallecula and epiglottis, that will be supplied by the internal laryngeal nerve. Right? Now, I have already told you in my previous class, supply is divided into general sensation and special sensation. Anterior two-thirds of the tongue, general sensation will be supplied by and special sensation. General sensation, lingual nerve. General sensation will be lingual nerve. Special sensation, chorda tympani nerve. Special sensation means taste. General sensation means pain, touch, temperature, etc. Now come to the posterior third. Posterior third will be supplied by the glossopharyngeal nerve. It carries both general sensation as well as special sensation. Posterior most part, it is supplied by the internal laryngeal nerve. It carries both taste as well as general sensation. Right. Now come to the muscle. The muscle of the tongue, whether it is a smooth muscle or skeletal muscle. Tongue muscle is key. Skeletal muscle is smooth muscle. Tongue muscle is key. Smooth muscle na skeletal. Well, tongue muscle is key. Smooth muscle na skeletal muscle. Huh? Skeletal muscle, very good. Skeletal muscle. It is developing from occipital myotome. Occipital myotome lies posteriorly in relation to the hindbrain in embryonic stage. Later it migrates towards the tongue. So when it will migrate, it will carry with it the nerve also. The nerve of the occipital myotome is the hypoglossal nerve. So hypoglossal nerve will come forward, crossing superficial all these structures. So the muscles of the tongue will be supplied by the hypoglossal nerve. If you are asked to explain why hypoglossal nerve, your answer should be as it is developing from the occipital myotome, and nerve of the occipital myotome is the hypoglossal nerve. That's why it is supplied by the hypoglossal nerve. One muscle of the tongue where there will be exception. Well, there will be exception. That exception should be asked. Out of the muscles of the tongue, one muscle is exception. That is palatoglossus. That palatoglossus actually is not supplied by the hypoglossal nerve. Palatoglossus muscle is supplied by cranial part of the accessory nerve. You will remember cranial part of the accessory nerve through pharyngeal plexus. All this should be written through pharyngeal plexus. Actually, cranial accessory has got no separate entity. It has not separate existence. It always accompanies the vagus nerve. Only the spinal part has separated, and you have seen spinal part access nerve. Where you have seen spinal part access nerve? In which triangle? Posterior triangle. Posterior triangle में आपने देखा कि it has separated from the accessory nerve and it has gone to the posterior triangle and it supplies two muscles, sternocleidomastoid and trapezius, and cranial part will accompany the vagus nerve, and that cranial part will form pharyngeal plexus. From that pharyngeal plexus, it supplies the palatoglossus. Right? So if sometimes may come as a short essay type question, muscles of the tongue. So you should divide muscles of the tongue into two parts, intrinsic muscle and extrinsic muscle. Intrinsic muscle I have already discussed. Now extrinsic muscles. Extrinsic muscles, one muscle is coming from the front side, that is the genioglossus. One is coming from the posterior aspect, styloglossus. One is coming from above, that is palatoglossus. One is coming from below, hypoglossus. And chondroglossus, there is another muscle. You may write or may not write. If you write, you should say that chondroglossus is the separated part of the hypoglossus. So all these muscles are extrinsic muscles of the tongue, and they are supplied by hypoglossal nerve except palatal-glossus. Palatal-glossus supplied by laryngeal plexus बोलने से नहीं होगा. Containing cranial accessory cranial कौन बोल रहे? কি দিবা স্বপ্ন দেখছো? বসে বসে. Now come to the intrinsic muscle. Intrinsic muscle come ki, what is the function of the intrinsic muscle and what is the function of the extrinsic muscle? Intrinsic muscle has got no bony connection. They remain confined within the tongue only. And extrinsic muscle has got one bony connection, other connection to the tongue. Their function is causing movement of the tongue. They move. External muscle will move. But internal muscle, by intrinsic muscle, they will change the shape. Intrinsic muscle only change the shape. Now intrinsic muscle has longitudinal, superior longitudinal, lies near the dorsum of the tongue, inferior longitudinal, lying near the ventral surface of the tongue or inferior surface of the tongue, transverse like this, and vertical means it will connect the dorsal surface and ventral surface, vertical. Now easily you can now explain their function. If superior longitudinal muscle contracts, that will concave the dorsal surface of the tongue. Concave. If inferior longitudinal contracts, it will convex the dorsum of the tongue. If transverse muscle contract, it will narrow the tongue. And if it is narrowed, then it will be to some extent elongated also. And if the vertical contract, it will flatten the tongue. So these are the functions of the intrinsic muscles. Right? Clear? এবার হয় তার মাসল হয়ে গেল. One muscle, very important muscle, sometimes it may come as a, that is called genioglossus. Genioglossus is coming from the upper genial tubercle to the tongue. This muscle is called safety muscle of the tongue. Which one is the safety muscle of the tongue? Genioglossus. Why it is safety muscle? Because you know genioglossus protrudes the tongue. যেটা বের করছিস protrudes. If both muscles are paralyzed, there are two muscles, then tongue will fall back. And if the tongue falls back, it will close the oropharynx, and patient may die of choking. কোন কন্ডিশন হতে পারে এরকম চোকিং জানিস? কখনো বাড়িতে লোককে দেখিনি অ্যানেস্থেসিয়া দিতে, অজ্ঞান করার পর দেখবি, অজ্ঞান করার পর পেশেন্টকে ওয়ার্ডে নিয়ে আসে না, একটা এয়ার টিউব পরানো থাকে যাতে ফল ব্যাক অফ দ্য টাং না হয়ে যায়. At the time of anesthesia, muscle become paralyzed, and at that time there is a chance of falling back of the tongue. To prevent that, one tube is inserted so that there will be no falling back. Now, when one muscle will be paralyzed, suppose one muscle has been paralyzed, when two muscles will act together, it will protrude the tongue. If suppose one muscle has become paralyzed and one muscle is acting, then what will happen? If that, suppose right muscle is intact, left muscle has become paralyzed, the right muscle will contract, the tip of the tongue. You will remember that the tip of the tongue will deviate to the opposite side. Tip of the tongue will deviate to the opposite side. One thing, if right contracts, the tip of the tongue will be left side. If left is contract, tip will be on the right side. Suppose now asking the patient to protrude his tongue, and by seeing the deviation, you will be able which side is paralyzed. তাহলে যেদিকে ডেভিয়েশন হয়েছে সেইটা প্যারালাইজ সাইড. ইজ ইট ক্লিয়ার? মুখ দেখে মনে হচ্ছে না ক্লিয়ার. আবার বলছি দেখ, The two muscles when will act together, tongue will be protracted or protrusion forward. If one muscle acts, suppose one muscle has become paralyzed. If right muscle acts, then it will pull. Right muscle will pull the base of the tongue and push the apex of the tongue towards the opposite side. It will pull the root of the tongue and push the apex of the tongue to the opposite side. Then right muscle is okay, then it will deviate the tongue towards the left side. Right? Clear? Clear নেই? যেদিকে ডেভিয়েশন হচ্ছে সেটা হচ্ছে তোর প্যারালাইজ সাইড। In case of angle of the mouth, suppose facial nerve has become paralyzed on the right side, then angle of the mouth will move to which side? যেদিকে মাসল মানে ইনট্যাক্ট আছে ওই সাইডের, তাই না? কিন্তু টাঙের ক্ষেত্রে উল্টো, যেদিকে মাসল প্যারালাইজ হয়ে গেছে সেই দিকেই গেছে কিন্তু বেঁকে। ইউ রিমেম্বার দ্যাট, এই জন্য যেটা বলা হচ্ছে, বুঝতে পারলি? If the tongue will move, the tip of the tongue will move to the opposite side. If right contracts, tip will move to the left side. Suppose right is paralyzed, left is acting. So if left acts, then tip will paralyze, move to the right side. Sometimes it may come as a short note, safety muscle of the tongue. Then you have to write all these things. Why it is called safety muscle? Because it prevents the falling back of the tongue posteriorly. If it falls posteriorly, it will close the oropharynx. So the patient may die of choking. So this is the safety muscle of the tongue. Now come to the lymphatic drainage হয়ে গেল, মাসলস হয়ে গেল, ডেভেলপমেন্ট হয়ে গেল। Now arterial supply. Tongue is supplied by which artery? Lingual artery. Lingual artery branch of compressor. Well, কতবার যে পড়ানো হয়েছে, লিঙ্গুয়াল আর্টারি কার ব্রাঞ্চ যদি বলতে না পারিস, এক্সটার্নাল ক্যাভিটি আর্টারি আর কতবার পড়বি? এক্সটার্নাল ক্যাভিটি আর্টারি আর কতবার পড়বি? মানে গোটা অ্যানাটমি তো বাকি পড়েই আছে। হ্যাঁ, এখনও পুরো নার্ভাস সিস্টেম মানে নিউরনের পুরো বাকি। আর একটা মাত্র সামান্য একটা এক্সটার্নাল ক্যাভিটির ব্রাঞ্চই এখনও মুখস্থ হয়নি। কি অবস্থা? লিঙ্গুয়াল তো লিঙ্গুয়াল মিনস টাং, গ্লসো মানে টাং, একটা ল্যাটিন একটা গ্রিক ওয়ার্ড। দ্য লিঙ্গুয়াল আর্টারি, ইট ইজ কামিং ফ্রম দ্য anterior aspect of the external carotid artery. This lingual artery is divided into three parts. Which muscle actually divides the lingual artery into three parts? This is the hypoglossal muscles. Hypoglossal muscle divides this lingual artery into three parts. This is the hyoid bone, this is the hypoglossal muscle, this is the tongue. Now, this is the external carotid artery. This is the greater cone of the tongue. Near the greater cone of the tongue, it makes a loop. Here it makes a loop. Then it will enter into the hypoglossus, deep to hypoglossus. Then after coming from here, it will go to the tip. This is the first part, this is the second part, this is the third part. From the first part, one branch goes like this. Superficial to the hyoid bone, and from the deep part 2 or 3 arteries arise. It is known as dorsal branch. This dorsal branch will supply the posterior part of the tongue as well as tonsil, palate, etc. From this anterior part, one goes, this is called sublingual branch. It is called sublingual branch. Sublingual. This one is deep lingual branch. One is deep lingual. It is a dorsal lingual, it is a deep lingual or arteria profunda lingui. Sometimes third part is known as arteria profunda lingui or profunda artery. Deep artery, deep lingual artery. Right. So main artery is a lingual artery. Vein, lingual vein. Vein where drains, lingual vein where drains. Here lies the, it is the external carotid artery. There is internal carotid artery. And here within the carotid sheath, what we will get? Internal jugular vein. So it will drain in the internal jugular vein. Vein will drain in the internal jugular vein. Right. So this is the arterial supply and venous drainage. Now, functional significance, functions of the tongue. I have already discussed, Function of the tongue, Right? এবার যে কোনো কোশ্চেন এলে এই যে বেসিক আইডিয়া থেকে লিখতে পারবি তো? বলো, where is problem? Is there any problem? Are you studying? How many hours?
2 hours.
Huh?
2 hours.
2 only? You have to sleep 6 hours and rest of the time you have to spend in studying. 2 hours in studying तो आर्ट्स का जो स्टूडेंट है वो भी तो नहीं पढ़ता है, वो तो 6 घंटा दे स्टडी, और आप मेडिकल में ओनली 2 hours, তাহলে বলতে জিনিয়াস আছে, এটা জিনিয়াসেরা তারা 2 ঘন্টা বলে হবে, কিছু আছে আর বাকি টাঙ্গে। What is the main function of the tongue? Main function of the tongue key? Speech. Swallowing. Deglutition. আচ্ছা, একটা জিনিস ভুলে গেছি, প্যাপিলা। প্যাপিলি অফ দি টাং, এটা ইম্পর্টেন্ট কোশ্চেন। প্যাপিলি, how many types of papilla are there? What are they? दो हो गया। Filiform, fungiform, foliate, and circumvallate or vallate. Vallate. Now, out of this, which one are numerous? That is filiform. Now come to the papillae of the tongue. Papillae of the tongue, there are 4 kinds of papillae. Number 1 and most numerous is which one? Most numerous? Filiform. Filiform is maximum number, and it imparts velvety appearance of the tongue. Anterior 2/3 of the tongue is velvety in appearance. That velvety in appearance because of the filiform, which is numerous. What are the difference of this filiform? What characteristic distinguishes the filiform from others? Well, one character by which you can differentiate filiform from others. Why filiform is different from others? আর একটা আছে মোস্ট, এটা একটা কারণ, ঠিক আছে। টিপ ইজ কেরাটিনাইজড এন্ড another important, हाँ
spread over the tongue.
वो तो ठीक है, वो तो numerous तो spread होगा. It doesn't contain any taste bud. Filiform doesn't contain any taste bud. Its tip is keratinized, right? And it imparts velvety appearance of the anterior 2/3 of the tongue. So what is function? तो function क्या होगा? जो टेस्ट बड नहीं है तो फंक्शन क्या होगा? It provides rough surface. A rough surface is needed for mastication and all these things, right? Now come to the fungiform. Fungiform is mushroom shaped. Upper part is globular and broad, and pedicle is narrow, and it projects above the surface of the filiform. And it is important because it contains on its surface the taste bud, right? Now come to the vallate. Vallate only 10 to 12 in number, and where it lies along the anterior margin of the sulcus terminalis. Though it lies within the territory of the anterior 2/3, you know the anterior 2/3 and posterior 1/3 is dividing line is sulcus terminalis. So this circumvallate papillae, regionally it belongs to the anterior 2/3, but its supply is coming from posterior 1/3. It is supplied by the glossopharyngeal nerve. You will remember this. It contains vallate papillae. It is surrounded by velum, by trench, by sulcus all around it, and the wall of the sulcus contains taste bud. So these are the vallate papillae. So if papillae come as a short note, you will write all these things. Now foliate papillae, where it lies? Foliate papillae mostly lies along the margin and tip, and to some extent it also lies within the filiform papillae also, but population is greater along the margin, right? Which part of the tongue is prone to cancer? টাঙের কোন জায়গায় ক্যান্সারটা বেশি হয়? ডরসামে, ভেন্ট্রাল সারফেসে, টিপে, না ল্যাটারাল মার্জিনে? Lateral margin. Generally, lateral margin of the tongue is more prone. Probably 65% cancer comes from the lateral margin, and 20-25% from the dorsum, posterior aspect, right? Now, the nature of the cancer, though you will study it in pathology, but here, nature of the cancer, which is developing anterior to 3rd, there is squamous in type. And posterior 3rd में जो कैंसर होता है, they are basal in type. Basal cancer. One important clinical problem is glossitis. What is glossitis? Jivegha. Jivegha. What happens in glossitis and why it develops? Glossitis why develops? Nutritional deficiency. If there is any vitamin deficiency, B complex, B12, then what will happen? The filiform papillae will be destroyed. If filiform is destroyed, then what will happen? Tongue will look plain. There will be no velvety appearance because the filiform papillae is destroyed. If there is destruction of the filiform papillae, so velvety appearance will be no there. It will be plain and red in color. Plain and red because of the destruction of the filiform papillae. This is called glossitis. Right? Sometimes there may be change in the epithelium. There may be change in the epithelium. Especially the foliate papillae, there may be change of the epithelium. That is called precancerous condition. If there is change in the epithelium, it will look whitish. Leukoplakia. So, the leukoplakia. That means the mucous membrane has changed its character, and it is a precancerous condition. If you get any case like this, you will refer to any surgeon for biopsy. Right? Leukoplakia. Any question? Follow.